A lot of females, once they get pregnant, once, twice, or maybe more times, they increase and decrease in size. And every time they increase or decrease in size after pregnancy, the extra skin does not shrink completely. And such women actually tend to develop a kind of tyre in the lower abdomen, which has extra skin and some amount of fat. These women may try to reduce all this extra flab of skin and fat by exercise and diet, but most of the times they are not able to achieve that. In fact, even if they reduce the fat, the hanging skin remains and they are never able to get back to the earlier body shape. So what's the remedy? Hi, I'm Dr. Priya Bansal, a board certified cosmetic and plastic surgeon practicing at the leading hospitals in India for more than a decade. I am here to address the concern that most mommies have. How can they get back into shape? How can they get back into shape after their pregnancy? So today we will be talking about body contouring for mommies who have a lot of excess skin and fat in the lower abdomen and have lost their pre-pregnancy body shape. Excess skin and fat on the abdomen is very common for mothers and very commonly operated by surgeons like me through a procedure called Lipo-Abdominoplasty or tummy tuck. So if you are someone who is considering a flatter tummy and an hourglass shape after childbirth, liposuction and body contouring abdominoplasty is for you. I'll explain how the surgery is done so that you also understand what gives you a beautiful shape and contour, especially with liposuction and tummy tuck. So let's get into the details quickly. All the extra fat and the skin that is accumulated around the abdomen after delivery, it adds to the weight of the exterior or the front of the body. And these women, they also start walking with a slight droop. Now, this is again an important issue to address because they may start developing backache. So this area certainly needs fat removal and skin removal to avoid many posture and health related issues. So I start with liposuction of the back, upper and lower, and of the love handles, the flanks, and the abdomen, upper and lower abdomen. Liposuction, it removes all the extra fat from these areas. Now one has to understand that once we do liposuction of all these areas, this lower hanging skin, it will further become loose and sag. So this hanging skin has to be removed as well. And that's where a complete contouring comes into picture. This contouring procedure is called tummy tuck. Now during a tummy tuck, all this extra hanging skin, it is excised and the edges are brought together and sutured. And the navel, it is repositioned to a more aesthetic position. I always make sure that the incision and the resulting scar, also called a bikini incision, it is kept very low right in your bikini line and always hidden even if you're wearing a bikini. Now when I perform a tummy tuck, my endeavor is also to achieve an hourglass shape for all the mommies out there. And how do I do this? Now we have two muscles in the midline called the recti muscles, and these are usually joined in the midline. But as you become pregnant and increase in weight and size, these muscles, they go apart and become lax. So what we need to do is suture the muscles together, one edge of the muscle to the other, and bring them closer. So this helps in achieving a thinner waistline. This is called divarication of recti muscle correction. Now what I also combine is a little bit of fat grafting. Since a lot of fat is already being removed from your body, I utilize this fat and put it in areas where you're thin, where you're narrow, like your hip dips or your butts, so as to achieve a complete hourglass shape. While I do this, I always discuss with my patient what degree of augmentation they desire. Not everyone wants huge buttocks and not everyone wants very small buttocks. So it's necessary to discuss it beforehand with the patient to achieve a nice hourglass shape. Now let me show you the comparative pictures of before and after of a lipo-abdominoplasty result. Look at the aesthetics of the body and how the shape has immensely improved. And remember, the results keep improving over the next few weeks as the swelling and bruising settles down. So tummy tuck combined with body contouring and fat grafting to the lateral or posterior buttocks, together they are very gratifying procedures for all the mommies out there to get their pre-pregnancy body back. What's more, after the complete body shaping, the patients can go back home the next day evening or after 48 hours and can resume all their daily activities. I ask my patients to take it slightly slow and light for the next 2 weeks. I would like to mention that in all my tummy tuck and body contouring procedures, I always use micro-air and Vaser technologies. These are kind of boons that science has given us to improve our results and give a better recovery period to the patients. If you want to know more about these scientific and successful medical techniques, watch my video which I have made specifically around these topics. To know more about tummy tuck and body contouring, you can read very interesting blogs on my website as well. So all the beautiful mothers, I can help you get back your pre-pregnancy body and look even more beautiful, fit, young and healthy. Let's connect and discuss your possibilities. I will see you soon in my next video. Stay tuned to this space.